Are there any side effects or downtime associated with a hair transplant?
So, hair transplant is an aesthetic procedure, like I mentioned. So, it has to be at the right setup by the right person, your surgeons, with the right tools, and to be done with the right patient. So, you have to be medically fit as well. So, when all these basic protocols are followed, you're not supposed to have side effects because post op medications are there to prevent any kind of infection. So, when all of this are done right, hair transplant does not have any side effects because it is your own hair from your own head just placed in a different place. So, no side effects.
Is there any post op care that people need to follow?
He has to first of all keep it safe. I have seen a lot of people after transplant, they're happy, they say bye, and they just go get hit in the door. So yes, I've had a patient where after he finished his hair transplant, while going out he just hit his head on the door. So you have to be careful, number one, because it takes 48 hours for your graft to properly get stuck inside your skin. So safety, very very important. Hydration is very important. So we give saline sprays. We've got post-op solutions where you spray it on your scalp to keep your scalp hydrated because you've just planted the seed. Proper blood circulation has not started yet. So you keep it hydrated, you don't let it dry off. And then hygiene. Hygiene is very important. And obviously medication. So you've got your antibiotics to prevent any kind of infection. You've got your anti-inflammatory to prevent any kind of swelling or any reaction. So all of these are there. They play a major role in the proper growth of your hair transplant. A lot of clinics use topical solutions as vasodilation, like your minoxidil. A lot of people use supplements, growth supplements. So all of these are definitely playing a role in your hair growth.
Is post hair transplant hair shedding normal?
Yes, it's normal. Like I would always compare hair transplant to gardening, where you take one plant from one side, you plant it in another place. All the leaves fall first, most of the leaves fall first, and then you have the new leaf coming up. So hair transplant is very, very similar because you take the graft from backside. So how does your graft actually look? The anatomy of it, you have the small follicle, and then you have the hair shaft, and then you have the hair coming out of your skin, surrounded by your skin and then your fat tissues. So when you're taking and planting it in the front, it's only the follicle that is going to actually get attached and start growing. So all the other stuff, your skin, the scab, the hair, all of them shed off. So yes, post-op shedding does happen. It sheds, most of it sheds, and then it grows back.
So, say that someone is completely bald and doesn't have a donor area. What would you suggest for some people like that?
When he doesn't have a good donor but still wants to have hair, we have different options, a completely different department called the non-clinical department. So it's where we cosmetically replace your hair. But to know more, stay tuned for my next podcast. And if you have some more questions, drop them below.